Hello, everyone. I see that some of you are still connecting.
Hi, good afternoon.
So nice to see a few familiar faces. Hi, Magdi. Who else is here? Hello,
Hi,
Ramaya.
yes, hello. Hi, how are you, Dina?
I'm doing well. How are you, Magdi?
I'm fine, just fine.
I'm
Just
glad.
a very busy day.
Oh, I'm sure. I'm very glad you could make it today.
Yes.
How are you, Ramaya?
Good, good. Weather is nice here after all these days.
Good.
We are getting into the spring.
Oh, finally.
Maybe Madhurika can tell what's happening in Delhi.
Hi, Madhulika.
Good evening. Hi,
Good
everyone.
evening.
Delhi is extremely hot. Extremely hot in Delhi.
Wow.
Okay. Well, it's actually the same temperature in Minneapolis, except you consider centigrade, I consider Fahrenheit. The same. The number is the same.
Right.
Mhm.
So we're just waiting on a few people to join us here, and then we'll begin shortly. Feel free, if you'd like, in the meantime, to just write your name, introduce yourselves to everyone, what region you're from, what country, in the chat.
Buenos días, Claudia.
Hello, Loredana.
Hi. Well, I was a bit confused because you sent an email for Monday, 9th of May, another one?
That's the third call.
Okay.
We are
So
busy.
I did click on this one and they said, no, it's not now. It's still okay. So maybe I missed something. Okay.
Well, I'm glad you came anyway.
So, okay, here I am. 3 minutes late.
No worries.
Well, the thing is my camera is not on the same side. Oops. Can you see me?
Yep.
Yes, we can see you perfectly.
I think there's something not working on my side.
Ramaya and I going from one meeting to the other.
Yes, yes. We just completed there. I thought I was going to miss something, but just in time. As I said, it was very productive meeting.
Yeah, without breathing time in between.
Right, right.
So, and you had a meeting over the night?
Yes.
I don't know.
We had
But
a
we
meeting.
are fresh and ready
Yeah,
for
yeah.
the next
You
one.
look like. Okay.
We're excited to start. So maybe I think we can start now,
Yeah.
Concha. What do you think?
Yeah, I think it's time to move.
Great.
Let me share the screen.
Yeah.
Just
sorry,
before we start, I have a comment. I said you email Nida because you did send registration and the presentation
Mm-hmm.
of last meeting. The problem is on Google Drive, no? I think.
Yeah, it is on there.
Okay, but for Switzerland, we're not allowed to have the link.
I see. I can try and
Institution.
share it with you again, just on PDF I can send you, if you prefer.
Well, okay, but I want access to the registration, to the record.
Okay, I'll download the recording as well. Maybe we can share that some other way.
Yes.
Yeah, we
well,
transfer would do.
Yeah,
Could you
because the
access?
institution do not allow to use Google Drive.
Ah, okay. Okay.
I did send you an email with the screenshot.
Yes, I responded to your email. I sent you some more information. I thought it was for the meeting.
Okay, so I'm too busy. I think miss some. Okay.
No worries, no worries. I'll follow up.
Okay, thank you.
Of course.
Yeah, and sorry, I probably have to leave at 4:30 for another meeting. So excuse me at 4:30 that I will leave.
No worries. Thanks for letting us know. So it's very nice to see you all. Thank you for joining us today. I'm excited to kick off this session, and I guess we'll just start with the agenda. We will go over our working group mandate again for those who did not join last time and are new to the group. We'll have a bit of a recap from our first workshop where we talked about 2 areas of intervention. We had discussed on national plans and strategies, as well as how to gain funding support from member states. And then we're going into our theme today, which is going to be on networked care. We're going to be talking about how we can work towards supporting the creation of networks of centers of expertise, as well as go into the designation and accreditation process. So we'll be watching 3 videos, one from Dr. Roberto Giuliani in Brazil, another from Dr. Edward Nealon from NORD in the US, and the third from Alba Ancochea in Spain. So these experts will all be sharing their best practices and sort of stimulate our discussion today. So why are we doing this? Just to give a brief overview, our UN resolution was adopted in December, and it calls upon member states to strengthen health systems in order to provide universal access to a wide range of healthcare systems or services. And so this call is linked to the empowerment of people living with rare diseases, both in terms of physical health, mental health, and going beyond that. So we would like to be encouraging member states to strengthen these systems just in terms of primary care and to provide access to the best possible care, to provide diagnostic tools and address their needs beyond this diagnosis. So as such, we've identified 5 areas of intervention at national level. And these actions include the development of national plans and strategies, the identification and designation of clinics, experts, and highly specialized centers of expertise, to encourage the creation of networks of experts and centers. These 2 are what we will be talking about today. And the 4th one is to support multidisciplinary care and promote the development of guidelines and care pathways. And the one that we had discussed last workshop as well was reflecting on how to best support sustainability of networks and expert centers. So with each recommendation, with our working group, we'll be developing an annex to include a list of potential supporting actions, just to give a scope of activities that would help to move towards each area of intervention. So to just briefly go over our methodology and timeline, we had our first workshop on the 25th of March, where we shared best practices, we had a discussion. After that, we sent a survey to the whole panel of experts in order to gain their expertise and suggestions for supporting actions. We then had an advocacy committee, the RDI advocacy committee. They looked over our recommendations, gave additional feedback. And today we're having our second workshop discussing networks. So after this, we will be presenting it at the policy event, at the WHA event on the 24th of May. I invite you all to join. It will be hybrid, so please feel free. And yeah, I guess we're just going to end with finalizing the 5 recommendations during the summer and coming up with not only that 5 recommendation statement, but preparing a toolkit so that we can encourage our panel of experts to work together and share these practices beyond this working group. So just a little recap from workshop 1. We identified some supporting actions with the help of our working group last time, as well as with the survey. And these are the actions that we've identified so far. The first is adopting a definition of rare diseases. Second is allocating resources in order to support the development and implementation of a national strategy. The third would be to establish this national multi-stakeholder expert committee in order to include patient representatives, as well as other representatives from regional and local systems. Last time, a big comment that we got was there's strong need for a united and coordinated patient advocacy group. So we wanted to address that over here. And then we also talked about organizing national workshops in order to identify rare disease needs and emerging strategies. Another point that we had touched on was the importance of data collection. So we've added this action on collecting and extrapolating data in order to support this awareness raising on rare diseases to different stakeholders, not just to policymakers. And the last was to engage key stakeholders and institutions in order to reflect on this need for specific legislation. So we have a Miro board where we posted up these ideas, and we wanted to be a bit dynamic today and invite you all to post a comment or post a chat on that Miro board. For those who are not comfortable, please feel free to just step in on the Zoom and speak up, but I am pasting that Miro board here. And
we both did.
great. On the same page.
Okay, let me go to the board.
Thanks,
If you
Mom.
don't feel comfortable with the board, feel free to stay here. So, and you can just raise your hands as you would normally do.
Okay, so where is the hand? Where is the hand?
Here. Oh,
Yes, Flaminia, I see you raise your hand.
Yes, can you go back to the list of
of actions. You will see them in a minute, Flaminia. Just a second.
sorry.
I'm having trouble moving the windows here
Ah.
because
I can go ahead
Don't
and share.
worry.
Yeah.
Take your
yeah,
time.
because I'm sharing, I get this screen on top and I cannot move.
Oh, good. I can go ahead and share.
Thank you,
Okay.
Nida. Oh,
Here,
yeah.
So here we have, these are our six that we've identified, and they were also on the presentation.
So yeah, for me, I have a comment about the word legislation.
Mhm.
So engage key stakeholders, the previous one, the yellow one. Yeah, engage key stakeholders and institutions to reflect on the need for specific legislation. I'm trying to see, do we mean additional legislation compared to the national plan? Because the national plan or the national strategy, and maybe Vicky can help, or any other person from a country where there is already a national strategy or a national plan, but it's not really a legislation as far as I understand it. So do we mean specific legislations in addition to the plan or the strategy, or what else actually do we mean? Do we mean a legislation for, I don't know, I'm inventing, like a legislation for specific accelerated access to orphan medicines, or do we mean, what do we mean? Yeah, I see Magdi had raised the hand, maybe, I don't know.
Yeah, I mean, Flavina, normally the national plan can define the needs, but then to cover these needs in each and every country, you need to have funding, and the funding usually requires a legislation. So for instance, we have like 2 plans for patients with rare diseases. One is to cover the age category from 0, from birth, until graduation from education. So this is universal to everyone. And then those who do not afterward enjoy the government insurance, they should have another plan. And for this, we needed a new legislation to include this under the handicapped law. I mean, there are certain privileges that the law can cover the handicapped persons for many reasons. So now, after discussion on some of the rare diseases, there is a trend to have all these who are identified as rare diseases and do not insure the primary insurance plan to be under this second one. So normally the legislation is to support the national plan regarding funding and expenditure.
Then I get, sorry, go ahead.
Yeah, this is my comment.
Thank you, Magdi. We also have a hand raised from Loredana.
Yes, I do agree with Magdi. I mean, that's the situation that we have in Switzerland. So we have a national concept on rare disease with the measure the needs of expert centers, of registry, but no funding at all because we don't have the legal basis. It's not written in the law that rare disease is a priority of public health. So now we are in this process It will take some time, but there are some politicians who are helping and supporting rare disease community, and they are submitting postula and motions. And so it's voted, and slowly we get there, and they have to create this legal basis. If I'm not wrong, in France, which is the first country and the model in Europe, they adopted rare disease as one of the 5th priority, public health priority, early 2000, just before the national plan, the first national plan. And because of this legal basis, they got funding to implement the reference centers and what they did with the first national plan. And now they are implementing the 3rd one, which is not, maybe it's already the case. But that's the difference between the national plan and the legislation. So that's how I understand it. And I support what Magdi said just before that.
Thank you, Loredana. We also have a comment from Vicky in the chat. She agrees with Flaminia and says that a few countries launch their national plans with legislation, for example, accompanied by a royal decree, etc. But I don't think most of national plans are legislative docs. But indeed, sometimes there is a legal definition of what a rare disease is, or regarding treatments, hello. As you said. Hello? Who's speaking?
No, I think we need to go on mute when we don't talk.
Okay, okay. Carlos raised his hand, so go ahead,
hello everyone. Good morning, good afternoon. Yes, well, completely agree. Also, it's important, for example, the case of Ecuador. We have the law that is part of the chapter for the national health law, but then take long time in order to have a specific regulation that will be managed by the Ministry of Health or the Ministry of Inclusion and Social Inclusion, and take this around 2 years. That means for the countries that have current registration also need a regulation or a specific guidelines in order to implement the law. And then the next step is to get a national plan. But again, the key problem is the funding. Also, as Loredana mentioned, the funding in order to cover this kind of actions. But also it's important that in this case, the Ministry of Health also have put in place the specific follow-up of the regulation and get the coordination with another parts. Usually the governments try to work in by themselves according to their priorities. And in the case of most of the countries that have in developing markets, the main prioritization is the common diseases or even the infectious diseases. And then they relegate the treatment of the rare diseases. That is important also to coordinate this with the Ministry of Health and also invite. I see one of the comments to establish a national multi-stakeholder expert committee that is so important in order to bring the patient voice, bring also the expertise voice that the healthcare professionals, the multidisciplinary team, the center of excellence, the academia, and then finally the representative of the national health. I think that is the most important. Also, when talking about the networking in our projects, again, to emphasize the importance of the commitment or the endorsement or the green light of the government. Now, that's so important because we can have a very good and nice regulations, legislation, very good decree or the United Nations resolution, but you don't have the green light of the endorsement of the government. It's not a good idea. It's not easy to implement in the end. And also the recognition of a big support and umbrella across the region and across the world will be great.
Thank you, Carlos. We also have Flaminia with a raised hand.
Yes, another question. Sorry, it's the first time I participate to these meetings and I have a lot of questions. This establish a multi-stakeholder expert committee, right? Would that be a bit similar to these other organized national workshops to identify rare disease needs and emerging strategies, in the sense, would this national multi-stakeholder expert committee be the one organizing these national workshops, or these national workshops would be only for patient group, patient representatives, because the expert committee would be made of different stakeholders. So I'm trying to see whether there is maybe a difference between what we're trying to create. You see what I mean? So how do you see it? Because I know that in some countries, there is already the experience of having this national multi-stakeholder expert committee for rare diseases who have developed together national strategies and plans, and they organize these workshops. So is this what we're talking about? I see Vicky, you want to say something?
Yes, yeah, I guess it's a really good point, Flaminia. It depends almost on, or it's almost a visual timeline of, what are the ideal steps to reach the national plan and strategy. And I think I agree that, we definitely need, getting the multi-stakeholder committee is crucial. And I guess what we've seen in the past is that committee ideally is the committee which is in charge of sort of drafting and shaping what should go into a national plan or strategy. And sometimes it stays in place as the body which is then in charge of implementing it, or sometimes the governments mix it up a bit, but there should definitely be one that's there to do the shaping and the drafting of what should go into a strategy or a plan. And then you definitely need a continued multi-stakeholder body of some sort to actually implement it, because we've seen, as you know, so often the plans or strategies, once they're there, they're stamped, they've got the ministerial launch, and then nothing ever happens ever again. So I guess that the blue bit in the middle, the meetings, I mean, you're right. I guess traditionally the multi-stakeholder committee would organize, you could either, if you had a pretty good idea of what your needs as a country are, you could go straight in and organize a more specific workshop on a topic like setting up a national registry. But if we're thinking here of countries that don't have plans or strategies yet, so it's quite an early phase, I think probably the classic way people have done it is to organize indeed a kind of, the multi-stakeholder committee organizes a broader multi-stakeholder national conference, which he'll have different sessions where they'll talk through the status quo for different topics. And they have, you have like a breakout session. I remember ones in the past when some of the European countries were starting to develop their plans and strategies. You would have one, big event, a day or 2 days, where you would try and get all of the official people and you get all of the multi-stakeholder participants. And you'd have a section talking around centers of expertise. What do we have? What do we need? You'd have a session talking about, a national registry or connecting our data systems better. So you do a kind of you would always use that, I guess, to then help you to take the next steps to develop what goes into your plan or strategy. But indeed, once you have such a policy in place, once you have a plan or strategy adopted, then, it's great to have more specific workshops where you really drive home in detail, okay, how do we really set up, our national biobanks and our registries for rare disease? But yeah, I guess it's the, figuring out the timeline is really important. Does that make any sense? Maybe not. Okay, good. That's at least how I those post-its, I think.
Okay, well, we have another hand from Magdi. Magdi, you're muted.
Yeah, sorry for I mean, for the first one, adopt a definition of rare diseases. Do we mean here a generic definition or a specific definition?
Would be generating a definition of rare diseases. I think what we had gotten from that was just that raising that awareness and establishing that it is a priority and what rare diseases are in your country.
Yes.
Yeah, I mean, there are international definitions for the rare diseases, but I mean, do we adopt this or not?
Yeah, so the point here is really like there are, so as you very well know, there is a general understanding of the fact that rare diseases key feature is their rarity, is their low prevalence, but of course, as it's I mean, you know, this threshold, this prevalence threshold varies in different regions in the world. So one thing that, for instance, we are trying to do as RDI, so Rare Diseases International, is really to provide the WHO and also the broader rare disease community with what is called an operational description of rare diseases. So to have at least a common understanding in different countries of what do we talk about when we talk about rare diseases, because we cannot develop specific legislations or plans for something that is not well understood. So this is what is meant here. It's really develop some sort of common understanding for policymakers to understand a bit in depth what do we mean when we talk about rare diseases. And then there is also a proposal to try and move towards a common prevalence threshold. Even though it's a bit premature, we cannot do this now, but at least generate some understanding about rare diseases.
Yeah,
I don't know.
because
Yeah.
CDC has the definition of, I think, of 1 in 2,000. Anything with prevalence less than 1 in 2,000 should be considered a rare disease.
Yeah.
Of course, it will differ from one place to the other, but also there are other categories which is very rare diseases. When we are talking about diseases with prevalence 1 in 500,000 or 1 in 1,000,000, should we mention something like this or not necessarily? And we just focus on the definition of rare diseases.
We traditionally try and not make subgroups within rare diseases in the sense that the national plans, but again, Vicky, maybe you have a lot of experience in that, is that, I mean, in a way, we only have one strength. It's to put all rare diseases together into, you know, speak with one voice. So the idea is that even though we can, you know, like underline the fact that most rare diseases are very, very rare, I see that Vicky is answering. So maybe Vicky, you can.
I was just saying, I think, you know, to reflect Magdi's point, we probably just changed the word on that post-it first of all to, you know, adopt, because what we want a country to do is to adopt the definition, not necessarily to create their own, but indeed, ideally, Flaminia, they will all adopt a definition. If so, you know, a group like RDI can say, actually, this is probably the best definition, and WHO can say this is the best sort of global definition for a rare disease, then the country would adopt that. But I mean, I agree, traditionally countries we haven't sort of gone down the lines of, you know, really rare or averagely rare or ultra rare, because it tends to just make as you said, make too many kind of subgroups. And, you know, the more we are together, and frankly, the bigger the numbers are using that definition, the better. So, you know, 300 million using the general kind of prevalence that people use is pretty good. Whereas if you start splitting it down to, you know, 30 million globally with such and such and 130 million with this, it doesn't have quite the same message maybe for the policymakers, but that's just a viewpoint.
Can you change definition with description in the little one, operational description? Because whatever we decide, sorry, Mark, whatever we decide as a threshold, what is it about? Like, before thinking on how to count it, it's more about getting to a common agreement on what we're counting.
Okay, Mark, please. And then after Mark, I think we should move to the next topic, which was theme number 5. So please, Mark.
Thank you. So my only comment is I'm looking at obviously a lot of great work here, but, you know, collecting and extrapolating the data to raise awareness and then allocating resources. I'm just wondering if we need to make sure that we have national communication strategies for each country on how we're going to create awareness and how we're going to communicate all of the priorities that we've identified, so that we can make sure that the most important stakeholders understand.
Yeah, good point, Mark. And this is something it was mentioned yesterday as well, right, Nida?
Yes, it was.
So it obviously was missing there. So thank you very much. So let's move on to the next topic.
Yeah, we can quickly have a discussion on this fifth area of intervention, because after we do have to get started on our workshop theme for today. So these are the supporting actions that we have identified with you all. It's obtaining financial support from governmental institutions and other bodies, including philanthropic funds and grants. Another that was identified was to provide administrative support to identify experts and centers of expertise. There was a point on raising public awareness to include rare disease in public health insurance schemes in order to support access to diagnosis, care, treatment, and beyond. And the fourth is to collaborate with national and international patient organizations in order to raise financial, organizational, and informational support, as well as local awareness. I know in our last workshop, Magdi had talked about the importance of collaboration with international patient organizations and how WFH has helped so many organizations in the EMRO region. So thoughts, feedbacks, comments, feel free.
This is the difficult one, clearly.
Mark, one question. Did you have your hand raised from before, or are you going to? Okay, sorry.
So again, maybe from countries where there is already a national, I don't know if you call it a policy or something about centers of expertise. How are they financed? Because one of the issues that was raised also at the advocacy committee, Ramaya, you might remember, is that in different countries, there is not such a thing as a center of expertise, not because there is not expertise, but because it's not qualified at national level as being a center of expertise. So in countries where there are, how are they supported? Can we envisage, I don't know, public-private partnership? Is it only supported at the hospital level? How is it funded? I think in the US there are centers of expertise as such. I don't know. This is really a difficult one.
Yeah, Dr. Kabrika may be able to comment on these expert centers in India.
There's also, yeah, Ramaya, we can hear you.
Yeah, yeah, there are centers there, but I'm not really sure that they are functioning the way we expect them to. It was announced some time ago, but apparently there is no at this time. I cannot say that they are on the paper, they are there.
Okay. There are one hand from Loredana and then Carlos.
Well, yeah, this is a tricky issue, but again, I think in France, I mean, they give quite substantial funding to create the expert centers. So I don't know if we have some people around who can give more information about that. But yeah, about 180 million, I think, to create the expert centers. So they have funding in France, public one, I think. In Switzerland, we don't have any. So again, and professionals are starting to complain, but they are officially designated by the National Coordination of Rare Disease. So at least they are recognized as expert centers. But in Switzerland, the healthcare providers, the funding is provided by the canton. But still, there's an issue about that, and we don't have the solution yet. But professionals are really complaining about not being funded to do more work and better coordination and transition with the patient and participate to the registry. So it's, of course, more work, but no extra support. It would be interesting to see how it is in France. And I don't know the example in Germany, but.
Thanks, Loredana. Carlos?
Well, completely agree with the comments, and also is the same situation here in the case of Latin America. But the advantage, for example, in the case of Colombia, that is a clear definition of center of expertise, of center of excellence. I think that is, if we're talking about sustainability, it's important to define well, maybe a common definition. Maybe we can establish again to WHO what is a center of expertise or center of excellence of rare diseases. Then also it's important to define the coverage of this center of excellence, because for example, here in USA, also we have specific centers that have an expertise for a specific disease or a specific part of the disease. How we can implement in the countries that have small countries a general center of expertise that englobe all of the disease or therapeutic areas. Then also we need to understand the sustainability not only in the point of view of funding, that is the most important in the end, but also in the terms of the training, education, update and technology. For the reason I think that is important to create a specific educational training to support this multidisciplinary team in charge for the rare diseases, kind of certification, maybe WHO or in national unit or RDI, following another certification, maybe you can implement something that also recognize the center of expertise or center of excellence, in addition to get endorsement of the public system, the Ministry of Health, for example, and then also create the syllabus in order to ensure that these people are well trained and maybe have a different kind of updates or yearly or each 5 years, something like this, in order that they have all the information, refresh the knowledge. And then related to the funding, we discussed in the beginning that the national plans was really hard to implement due to funding. I think that in the case of the Center of Expertise is the same impact, and maybe we can create something that have an international consortium, like happened with another big projects in terms of the energy development, or when talking about the now, for example, with the vaccines with Gavi, something that have an international consortium that get all of the funding by public, private sectors, crowdfunding, the governments, and establish one line of criteria in order to establish if you meet the criteria of center of expertise, you have the education and training, you have a qualified multidisciplinary team, you have the option to have access to this consortium and get $100,000 per each of the checklist. And this consortium manages the funding, in addition to the collaboration and also the commitment of the local governments to support this center of expertise at country level.
Thank you.
It's a dream.
We have Magdi and then Madhulika. Thank you, Carlos.
Yeah, thank you. I mean, from my experience, you would find pockets of centers of experience in each country per specific disease. But I mean, the situation is that these centers most probably are working either on community support or they are suffering because they do not have enough funding. And I'm particularly here focusing on the developing countries. So as we, in this direction, if we are getting the blessing of the WHO, I think the WHO should encourage each government to establish at least a national committee for rare diseases, who can be an overarching body that can gradually take care of the local centers of excellence or expertise. I remember I had a talk with one of the ministers of health about, for example, hemophilia. And although hemophilia, there is a good number of patients in Egypt, but he told me at the end, in order to discuss this in the parliament and get funding, we need a mass of patients, not only small numbers. So if we encourage establishing a committee, a national committee that overarches all the rare diseases, and then the different centers of excellence will feed into this committee the data and share the data, then it can probably become more clear to the governments about the size of funding they need to put in place and the requirements of each and at least if we're talking from the medical point of view of the different rare diseases related to the different body disciplines. I mean, hematology, cardiovascular, musculoskeletal. They can understand that, okay, in total, we have in our country this amount of patients. These are the different drugs that we are needing. This is what we can work on for a plan for the future in cooperation with the NGOs, patient organizations, centers of excellence, the WHO and our initiative. It can be more systematic approach. It will take time, but at least it can be organized.
Thank you so much, Magdi. Let's move to Madhulika, and then we will continue with the workshop and the next part.
Thanks, Panka. What I think I spoke about this earlier also. So in India, as the policy is new, but in this policy itself, which was last year, March, the policy states that there are 8 centers of excellence which have been already identified. And there were some criteria which were used initially by the Ministry of Health to recognize these centers. And to all these centers, some broad objectives have been given. But as was being discussed, I think we have to have probably more targeted objectives, which are quantifiable and things like that. So that is in process now. And even because India is huge, no? So most people are saying that 8 centers are actually inadequate based on the number of patients we have. So the work is going on to objectivize the criteria for identification as centers of excellence. That is in process. And the other thing which is also being tried to objectivize is the functionality of these centers of excellence, and how do you actually finally decide whether the functioning of these centers is optimal or no. So some outcomes, what are there. So this is being worked on. And another thing which was in fact raised in some of the meetings is that, say, as of now, each center has been designated some general kind of objectives, but all of these centers have expertise in specific disease areas. And maybe in the future, it will probably be decided that probably this particular center of excellence, in addition to doing, say, general things or the commoner things, would focus on a particular disorder. So this is also being worked on. And as regards the overarching committee, that has also been formed by the Ministry of Health, and it is called the Central Technical Committee. So all the in charges of these centers of excellence are the member of this committee. But in addition, there are other experts also, let's say from basic science groups, from the ministry, and maybe from the some other groups which are important for the sort of execution of the functioning of the centers of excellence. So this is the mode which has been worked on, and I must say we are in very preliminary stages, but that's the, kind of plan which is there for execution of the rare disease policy. Thank you very much. That's from my side.
Thank you so much.
Marie. Actually, maybe we will follow up with you on that so that you can share some more with us. It would be great to get your perspective on this.
Sure, sure. I'll do that, Nita. Thank you.
Thank you. Perhaps we can move on, Concha?
Yeah, I'm gonna share the presentation. Oh, no, well. Let me share with you today's working plan. So apart from reviewing the actions suggested for you and collected through the survey we sent to the whole panel of experts, we would like to start watching 2 videos on 2 areas of intervention: identifying and designating rare disease experts and centers of expertise, and creating networks of experts and multidisciplinary, I don't know.
Yes.
Disciplinary. Let's try
Thank
it.
you. Disciplinary specialized expert centers. So I'm going to share a video with you and then another one. First things first, where are the videos? They are supposed to be here. So yeah, that's the first one. Oops.
Hello, my name is Roberto Giuliani. I am a medical geneticist working in Porto Alegre in the south of Brazil. And I will approach the topic supporting the creation of a national network of experts and or multidisciplinary specialized expert centers for rare disease. I am the founder of the House of Rares, a new initiative in Brazil, and I will present my experience to you. So what was the initiative taken? I can say that in the beginning we created an institute, the Genetics for All Institute. It was founded by clinicians and scientists to promote the access of patients to diagnosis and treatment of rare genetic diseases in Brazil. And at some point we met with Casa Hunter. Casa Hunter was an organization founded by families of patients with rare disease to promote a comprehensive and integrated care of these patients. So we joined the efforts, and then together we created the House of Rare, or Casa dos Raros. That is a center for comprehensive care and training in rare diseases. So we started to build a facility on my seat in Porto Alegre in the south of Brazil, aiming to providing multidisciplinary clinical care to patients with rare diseases, to have a diagnostic laboratory, also to promote funded neonatal screening, perform some research, basic research, translational and clinical research. We will have an undiagnosed disease program, also a rare disease registry. We'll perform natural history studies, and we'll have a biobank and provide training in rare disease for health professionals, and also information and education to the public. So what were the circumstances that motivated our organization to undertake this initiative? Well, I have to say that Brazil is a large country, is half of South America, and now has 115 million inhabitants, which is the world 50. And there are few rare disease reference centers in the country. We have 27 states and less than 20 rare disease reference centers. And in fact, these centers have very limited resources because they work on the public health system that covers 75% of Brazilian population, but very limited resources. And even the best ranked centers operate in a way that do not improve the huge diagnostic delay. I will talk about our experience. We have a center in the south of Brazil, in Porto Alegre, where I work. It's a very well maintained and very good resources on this center in human resources and also equipment. And it's a very sophisticated center, but even that, we have 3,000 patients in the waiting list for a consultation due to a suspected rare disease. So we should do something different to improve the situation. So what did you aim to achieve with this initiative? So what we intend is to have a rare disease center in Porto Alegre, in the very south of Brazil. And this will be the first of a network of rare disease centers covering all 5 Brazilian regions. A second center is already planned for São Paulo, and then we'll have centers in the northeast, in the north, center-west, and in the north Brazilian regions. So what method we used? In fact, the main task was to establish a partnership with the society. And this just to exemplify, we were able to mobilize the main partners in the society, the government, the football teams, all the parliament, and this is an example of the Rare Disease Days. We are able to motivate these organizations and also have a very good presence in the press, in the media, and we engage with the society. I think this is key for the success of this initiative. So what has been our experience in learners, and as we develop this initiative, I would say that the most important is to have a group of people that is very motivated. And in this picture, we have a group of people involved with the House of Rares. There are entrepreneurs, there are scientists, patient advocates, there are lawyers, health authorities, and health professionals, and people from the society that are just motivated to voluntarily contribute. So this was the key task. And what has been the impact to date in our healthcare system or beyond? Well, the fact is that we are almost ready, our buildings are almost ready to start operations. We had this huge support from the society. This building was made especially with donations from the society. We established agreement with the national, state, and city health authorities. So when you start operation, already have in place these agreements, and we established partnership with universities, centers, laboratories, and hospitals. And we intend to start operation still this year in the second half of 2022. So these are my presentation on this initiative. If you have questions, do not hesitate in asking me. And I thank you very much. Here is my email address if you want to make any comment or questions. Thank you.
Okay, so now we are going to share another one with you, and then we will we will have a discussion about these 2 videos.
I guess before we watch the second one, it's important to see the different perspective, because Roberto's sharing from Brazil, and he's starting up this network. And the video that we're going to see next is by Dr. Edward Nealon from NORD, and they're strengthening the network that they have. So it's interesting to see the difference.
Hello, I'm Dr. Edward Nealon, and I'm the Chief Medical and Scientific Officer at NORD, the National Organization for Rare Disorders. 39 years ago, the founders of NORD were instrumental in the creation and passage of the United States Orphan Drug Law, which has greatly expanded the development of treatments for rare diseases. Today, NORD, a nonprofit organization, represents a federation of greater than 130 member organizations, and we continue to fight to improve the lives of all rare disease patients and families by advancing rare disease policy, education, research, and care. Today, I'm very pleased to give you an update on one of NORD's newest initiatives, our recent designation of a nationwide network of NORD Rare Disease Centers of Excellence. While some progress has been made in the US and elsewhere, rare disease patients, caregivers, and clinicians continue to face an array of difficult challenges, including, for example, the small numbers of medical experts in these disorders, the long diagnostic odyssey that is typical for rare disease patients, and the lack of approved treatments for most of these conditions. Solving these problems is going to require even more robust collaborations between stakeholders. That need for further collaborations is at the heart of NORD's decision to select, designate, and partner with a nationwide network of NORD Rare Disease Centers of Excellence. What do we want this network of collaborating centers of excellence, or COEs, to do? Two things primarily. One, help patients who are struggling to find answers identify centers with deep expertise in rare diseases for faster diagnosis, improved clinical care, and/or connecting them to researchers in clinical research studies. And two, catalyze collaborations between the COE sites to work on the many clinical, scientific, and policy problems facing rare disease patients, which cannot be addressed by a single medical center acting alone, by sharing expertise and working together to find better solutions. What will the benefits to patients include? An ability to search for an appropriate center of expertise across the designated network, access to medical expertise and consistent high-quality clinical care, reduced time to diagnosis through pooled knowledge and expertise, pre-identification for and participation in research studies, expedited navigation to find community-provided resources and support, access to educational programming provided by expert clinicians, and all of this facilitated by meeting patients closer to where they live. These and other benefits to patients will be realized by supporting each center of excellence with access to shared knowledge and resources, such as clinical protocols, diagnostic coordination, advocacy assistance, innovative technology, researchers, and educational materials and programs. How are we building and enabling this collaborative network? NORD's COE model envisions 3 key steps to improve results for patients. 1, selecting a network of centers with high clinical capacity and expertise. 2, interconnect that network through shared knowledge, standards, and protocols. 3, leverage the network to create a patient-centric model that focuses on developing best practices, better patient education, better physician training, and more and better research for rare diseases. NORD's process for selecting and designating centers of excellence involved an extensive application, including more than 120 questions and targeted interviews. This application and review process sought to identify medical centers with key shared qualifications, including a commitment to rare disease patients and their families, coordinated multi-specialty care, support for the transition from pediatric to adult care, education and training of students and medical professionals in rare diseases, and actively contributing to rare disease research and new models of therapy and care in rare diseases. In November of 2021, after the completion of the selection process, 31 NORD centers of excellence, which are listed here alphabetically by state. Although chosen primarily for their strong rare disease programs, these centers are also very broadly capable. Of note, although these 31 centers represent only 16% of the 192 medical schools in the United States, this group includes, amongst other past recognitions, 10 of the top 14 medical schools as ranked by US News and World Report, and 8 of the top 10 US News and World Report children's hospitals. To encourage further collaboration amongst the rare disease experts in this network, NORD is providing coordination and resources, including, for example, online IT resources and meeting platforms, in order to realize our vision that, linked by a shared collaboration platform and frequent virtual meetings, NORD's network of rare disease centers of excellence will create rich opportunities for sharing clinical expertise, faster diagnosis, collaborative research projects, and clinical trials, often led or initiated by one site, but that whenever practical, will be spread to other sites in the network. While NORD has some specific projects in mind, we expect that many of the best ideas will come from the COE sites themselves. This includes the development of new best clinical practices, including, for example, treatment guidelines that can then be quickly shared across the network and beyond. these efforts overall leading to improved outcomes for patients. Although our site designations were only made a few months ago, we have begun to make progress building this into an enthusiastic and collaborative network. A common membership agreement was signed by all 31 sites and by NORD. Then on November 4th, the list of sites was announced and coordinated press releases and posted on NORD's website. Individual calls were held with each of the 31 COE site directors during the month of December. These individual calls confirmed a very high degree of enthusiasm for collaborating with NORD and with the other COE sites. And these calls were also very helpful in building an early consensus on some key points. For example, the site directors each identified a similar list of unmet needs in the rare disease field. And so we were able to decide on a consensus list of working groups, which I will show on the next slide. On the left side is a list of unmet needs for rare diseases that were identified by most, if not all, of the COE site directors. On the right side is a list of the corresponding working groups that we have now impaneled, comprised of expert faculty and staff drawn from the COE sites. Collectively, approximately 200 faculty have volunteered for these 11 working groups. Each working group will begin its work by assessing their targeted unmet need and will then make recommendations to NORD and to the COE Advisory Committee, comprised of the 31 center directors, suggesting which approaches might best be taken to accelerate progress in these key areas. The problems to be addressed include, for example, shortening the long diagnostic odyssey, encouraging telemedicine and intersite consultations as means of bringing expertise to the patients where they are, facilitating multi-site research and clinical trials within the network, and other important efforts such as improving education, training, advocating together to address public policy issues, and improving diversity, equity, and inclusion in all of these efforts. In terms of our aspirational goal of providing help directly or indirectly to all patients with rare diseases in the United States, it's important to note that the US population includes approximately 330 million people, served by 192 medical schools and more than 6,000 hospitals, including 262 standalone children's hospitals. Given our initial designation of 31 centers of excellence, on average, that's 6 medical schools and 198 hospitals for each of the current centers of excellence. Fortunately, each COE tends already to have a regional referral network extending its reach. Those referral networks have developed over many years, and in general, we expect each COE to push some of the network's expert knowledge outward while providing consultations to other hospitals and physicians. This will give the network as a whole a deeper reach and a wider impact. Of course, there's also some room to expand the list of COE sites. Overall, the expertise of the directors, faculty, and staff at our COE sites, as well as their enthusiasm for working together and with NORD, gives me confidence that this network will be effective in advancing and accelerating diagnosis, care, and research for rare diseases. Thank you.
Okay, so now let's go back to to Miro, please. Thank you, Nida.
Yeah.
Perfect. So these are some of the actions that have been suggested by some of you in the survey we sent to everyone related to this topic, to creating standards for centers of excellence and designation and collaboration. So feel free to look at these actions that are already here and think about, based on your experience, what would you think would be the best supporting actions in order to create a rare disease network?
Claudia, go for it.
Hi, yeah, so I thought the videos were very interesting, and this North last one was very interesting. And just I think it might be worth that we remember that, I mean, the US has been able to tend to patients with rare diseases and do genomic diagnostics and molecular diagnostics for a long time now, like more than a decade, and they are just now getting these networks. So in terms of like, yes, it is necessary to have centers of excellence in different parts of the world and in different countries, but also like some of the more advanced countries are just sort of setting up those, which I thought was relevant to sort of keep in mind that. I think the organization of the network is interesting, and my main question for this would be where is the funding coming from? So are these centers mostly reference centers for patients to go and receive care and diagnosis, but I mean, their insurance plans, whatever those are the ones that pay for that? And so there's no federal or other funding that it's so sort of supporting the network, because I think that's very important, especially in the context of other health systems, mostly like national health systems, where like are very dependent on federal funding. So that would be a major question for me in terms of how this network is functioning in the US, because what it seems to me, and based in my experience with the US health system, is that these are mostly just clinical referring centers that can do clinical management and diagnosis and that, but ultimately the patient is paying for all these services. So this would be an important consideration.
Okay, thank you, Claudia. What we can do is to share the emails of the speakers afterwards, so you can ask them directly and establish a discussion about that. What we would like to get from this exercise right now is to, based on what these videos explain and the ideas in the board, is to get what would you think would be the actions that could support the creation of a network, and obviously funding is one of them. We can see that another one suggested was establish partnerships with multiple stakeholders, as we saw in the first video. Even the major football team was involved. So that's basically the idea of the exercise. We have a hand raised from Carlos.
Yes, I think that in the both examples is one organization in charge of the process. I think that is the most important step. In the case of the Brazil, is more the public system. And then in the case of the North is the patient advocacy group that is in charge to recognize. And this is have another examples in other countries. I think that is the first step. Define if the Ministry of Health or the government is in charge, or the academia will be in charge, or the medical society or the patient advocacy groups is in charge. Another example is PPMD here in USA, that working very close to develop the DMD Center of Excellence, or Neuromuscular Center of Excellence, for example. Then the other part is, and I like the presentation of North, they have what is the steps or the list that they need to follow in order to include the Center of Excellence. As mentioned also in the last part you've seen in my text message in the chat, is to create this one, because the countries need to know what is the steps, how is the metrics to qualify as a real Center of Excellence. And then considering what happened in the first video with Dr. Gugliani, also the importance to define full rare disease Center of Excellence in order not get any patient left behind, especially when talking and discussing the beginning about the ultra rare diseases. And then also the recognition to have specialized centers for a specific disease or a specific action, For example, to apply gene therapy, we need an infusion centers that not all of the centers of expertise may be qualified for GIDA infusion center. I think that is the steps that we need to follow.
Thank you very much, Carlos. Would anyone would like to build on that or to add something new? We have Magdi. Thank you, Magdi. You're muted.
Yes, it's okay.
Right.
Thank you, Concord. I mean, we will have different models in different countries. But basics, we have to identify two issues. One, the existence of excellence centers of different diseases, and usually they will be very specialized. And then I mean, the formation of a body or an entity, name it what it is, to try to collect all different specialties of centers of excellence under one umbrella for the rare diseases. Because, I mean, I cannot see where is the authority if we have like more than 100 rare disease. And how can we put this under one umbrella? This is the real question. So are we going to as the CG and encourage the formation of one body or one organization per country that can be like an umbrella to attract all the different centers of excellence on the different diseases, and then can create the advocacy through this for the whole rare disease types with the government and the community, while in the meantime that each of these individual organizations and centers per disease, they may have their activities. So the question here that we need to brainstorm very well, how can we create an organization, whether it is governmental, whether it is NGO, to act as an umbrella for all the rare diseases? Because this is important? Yes, it's very important, because usually governments would give support to a mass. So if we give a generic name to the rare disease, that these are rare diseases, no matter what is the type of the disease, we are probably able to get funding for each and every rare disease, instead of being separate diseases competing for the funding. So this is something that we need to put in mind and try to brainstorm during the next period. How are we going to move in this direction?
Thank you, Magdi. This is something that was mentioned as well yesterday, just one voice. Yeah, Gareth was really advocating for that and mentioning that since until the moment that in Australia had this patient organization representing all the diseases, it was when everything started to move. Okay, we have more hands, Claudia and then Marian.
Yeah, just to mention that I agree with Carlos that I think, and what you just said, right, that the major turning point is sort of having organizing entity, right? In this case, NORD as a patient, umbrella patient organization to coordinate the efforts. So, and provide organizational and logistical support to that network. And the other part is that I think it's important to leverage what it's already there. So I particularly like the approach in which, I mean, they didn't create new centers, but they just put out kind of the call and the list of items that they thought these centers should be able to fulfill. And then those that fulfilled are part of the network, but it's not like they try to create a new center, which I think in many contexts might be more complicated to create from zero a new institution or a new organization for that particular purpose, but to establish those criteria and leverage what is already there. So I think like this initiative with WHO and RDI, what can contribute is to come up with those criteria for centers of excellence that are consistent across the world. But then sort of one organization that sort of has the boots on the ground in each country that can implement these organizational logistical part would be very, very important.
Thank you very much, Claudia. Mariam?
Yes, good evening from my place in Bahrain. So, but I just want to share our experience in Bahrain. Bahrain is a small island in one of the Gulf countries. I think the first thing that we will need to face is, as Dr. Mekdi said, there might be pockets of centers of excellence that first we need to recognize them. Because some of them may be, as he mentioned, specialized in certain rare diseases, not all of the rare diseases. So I think we will have a lot of challenges that we're going to face. First, that we need to recognize these centers, and then the networking part. And also for us, because now there is also change in the health policy. Before it was Ministry of Health that was in control of everything. And there was one main center, which was in control of most of the rare disorders. But now they started privatization, they started the insurance. So even the policies are being changing from time to time. So we don't know even who will be the main funding. Is it the Ministry of Health? We need stockholders? So I think now there is a big major change in the health policy in our country, that even for us with the funding thing, we will be facing a problem with it, like to approach the right people.
Mm-hmm.
Yes, and this is a common theme that we've been hearing actually in several of our workshops, is how do we get the funding for all of these things? Everyone says that these ideas are great, and they are, but logistically also thinking about how to get the budget.
Thank you. Anyone would like to build on that, or are you happy to move to the next video? Loredana?
Yes, well, just one more reaction. Yeah, it's also with my experience and with Orphanet, I would say, because I guess what first step would be to map what does exist in countries. So do a mapping. Then you realize that, I mean, there are many patient organizations working in their own, so bring them together and do an alliance. Then are there any specific expertise in the country? What are the different actions on rare disease? And then you can see that there are several maybe things that you can bring together after that. So this idea of mapping first, I think it's a good point to start with, and then to create a kind of coordination center with all the stakeholders. Because if in some country you have several patient organizations but no alliance, so it's already a first step. So first get together and you be heard as a whole rare disease community. And then see, and my experience with the patients, starting with them, then the professional, the clinicians follow, and they're happy then to be part of the community and to support, and yeah, and maybe ensure also, well, through websites, the visibility of the resources you can provide. And I don't know if one day we can have a vision of a huge rare disease network, and you could find by disease where are the experts through the world. I mean, a kind of what we do have with Orphanet, actually, and a multilingual also website. So Orphanet is 40 countries and available in 9 languages. So you know where are the patient organization, you have information on disease, you know where are the expert centers and research. Well, this word of mapping what's going on in each country, to start with that and then put together the stakeholders.
Thank you, Loredana. It's a great suggestion. And that would give also each country the possibility to adapt and build on what they have, and not just to create something standard. Okay, any more thoughts on that? No? Okay, so let's go for the last video of today. If I find it, I'm a disaster. You have to apologize me for that. Okay, I think I have it here. Yes. Okay. This video is from Alba Ancochea from Spain, from FEDER, and she's going to explain how the Spanish system for identifying, selecting, and designating rare disease centers works. So.
First of all, I want to thank CRDI for giving me the chance to share our experience on identifying, selecting, and designating centers of expertise in Spain. The breadth of reference centers, services, and units, briefly called in Spain PESUR, but from now on, Center of Expertise of the Spanish National System of Health, takes place in European recommendations of 2009. The procedure for designation and accreditation of Center of Expertise are established in 2006 with the following objectives: improve equity in the access to highly specialized systems. It must be noticed that Spain is a decentralized system, and so every region has its own system of health. Although they all must cover a minimum services and standards, every region has its own budget and its own functioning. That means that it's not so easy to be assisted in a different region. The second one is to concentrate the expertise with a high level of specialization, ensuring high quality, safe, and efficient healthcare. Fortunately, Center of Expertise allowed clinicians to refer patients from one region to the other as long as the region the patient lives in has the expertise or the technology the patient requires in that place. And as expected, it was also made for improving care of low prevalence diseases. Our Center of Expertise designation procedure is really complex. It means, first of all, the selection of the group of diseases, then the designation criteria, then it must be approved by a governmental body, then the assessment procedure, then the designation, but again, the governmental body must approve. It will be followed by a monitoring system every 5-10 years. Let me share with you briefly how this procedure works. The designation body to select centers of expertise is called the Committee for Center of Expertise Designation and belongs to the Ministry of Health. It's comprised of representatives of all autonomous regions. It means 17 autonomous regions representatives, the National Transplant Organization, the Spanish HCA, and the Ministry of Health itself by its technicians. All decisions are adopted by consensus, and this is the committee that prioritizes the areas of expertise to address And then the committee, once it's selected a group of diseases, also works with an expert group and a kind of advisor expert group in different fields. These experts are appointed again by autonomous regions, and they also work with the societies, scientific societies. But patients are not straight here in this procedure. Patients, after years of advocacy, are allowed to propose an expert for this advisory group. And this clinician or this expert are the ones that are going to be the patient's voice. But we have not the chance to be straight involved in the procedure. Once the criteria for a center of expertise is agreed by this council and committee, the interterritorial committee, that is again a governmental committee composed of delegates of health in every region, must approve the designation criteria. Once the designation criteria is approved, then the assessment procedure is open. And the regions are the one that should propose centers that they expect are going to fulfill the criteria. And then an external auditory is going to appraise the centers, and if they passes the examination, they will be designated as the center of expertise. Then they will have this monitoring system that if 5 years after they still fulfill criteria, they will be redesignated. This system of monitoring is really comprehensive. I'm not going to spend too much time in, but I want to highlight again that the patients, we are not involved in this monitoring system. We were once suggested to participate in a kind of satisfaction scale, but just that. And we expect that once the upcoming digital platform that is going to connect the Center of Expertise and it's going to work with the ERM would take into consideration patients' feedback. But by the moment, we are not taking into consideration for this monitoring. And this is one of our challenges, because sometimes after 5 years, the Center of Expertise don't work as we expected. No? I'm going now to review the main strengths and weakness of our system of designation criteria. It requests to develop actions regarding the field of the Center of Expertise activity. They must count on with a multidisciplinary team to work. They should have the humans and equipment resources sufficient, and to develop research activities and professional training. They should guarantee patient safety and to have a kind of protocol for transitions from children to adult service, and for sure to have an efficient monitoring system. What are the weaknesses? The weaknesses are referral. Referral is a challenge due to two main reasons. The first one is the upfront payment, and the second one is some regions, they don't want to refer complex patients because it's in a way to recognize that they don't have the knowledge enough to treat that patients, and that's why they prefer to keep the patients in the system. So we have these two main challenges in referring patients. Also, the financial compensation of care given among autonomous communities. That's where I told you that it's very complex system. And the Center of Expertise designation, as I mentioned, is a very long and tedious procedure. It can take up to 2 years to receive a designation. There are very low resources allocated for this procedure. Many times the Center of Expertise functioning holds on clinicians' will, because they are very engaged with patients, and a scarce of knowledge among clinicians. when a clinician is expected to refer a patient, I sadly say that still patients are the ones that inform clinicians that there is a center of expertise for their disease. And then what happened when ERN arrived? Even Eurordis and FEDER, we had informed in advanced countries, the countries were not ready enough to take the challenge. Center of expertise criteria designation wasn't laid out according to ERN. And there were center of expertise that didn't fit in any ERN, unless fit in 2 or 3 ERN. And there was no time to adapt the criteria. So the Minister of Health made an effort to try to make it work, allowing some centers of expertise designated for similar procedural groups to participate in a few ERN, but it also bring about a kind of discrimination between centers, because a few centers didn't apply because they thought they weren't going to fulfill criteria, and this was a very violent situation in Spain. In addition, there was a kind of double endorsement. It was not enough to be a center of expertise, because we should, if a center wanted to participate in ERN, it must be applied by the regions before. So firstly, the region should propose the center, and then the nation should endorse the center. So it was very complex to be part of ERN, and that's the reason why for the first call, just Spain were in 17 of the 24 ERN.
Okay. So let's go back to Miro. So I'm going to stop sharing. So if you would like, thank you, Nida.
Yes, this is our last discussion on designation and accreditation of centers of expertise.
Thanks, Nida. So you have here some ideas that came from the survey we shared with you. So let's do the same as we did before, based on what you have heard and based on your experience of what you know about your formal or informal networks. What would you consider the key actions to support the identification and designation of expert centers? If easy to identify, if not.
I've pulled a couple of our comments from our other conversation as well. There's some similarities and overlaps.
Yeah, I think
sorry.
It's good, Nina, that you've pulled some over, because I guess, yeah, we've almost done kind of one of the first steps at the end of the discussion in a way, because absolutely, you know, the designation bit is really crucial, and relating to designation is just what you consider a center of expertise to be. So I guess we've already talked about that a little bit, and we I suppose probably the idea is for this network or for RDI to kind of see guidance or criteria that countries could use to do this process. And we know from even just looking at, you know, a few countries, well, we've seen from the examples that countries do this very differently. But I guess, you know, to be aware that we're wanting to do this in all countries in the world, and we wanted to support countries in taking the first steps in this, we have to think about a few different levels. So we have to think about a stepwise development. If a country has no centers of expertise for rare diseases, and, you know, things are, you know, they're struggling just sometimes with the mainstream health services, they're not going to be, you know, able to access, you know, a kind of high-tech next generation sequencing diagnostics facilities all the time, and they maybe aren't going to be involved in lots of clinical trials and have all of these other things that we'd like. So we probably need to think about, you know, a sort of a, you know, core basic you know, fundamental criteria for a center of expertise, all the way up to, you know, more high level, because yeah, countries, even thinking about Europe, countries, you know, do this very differently, and still in some of the countries they will say, yes, we have centers of expertise for rare diseases, but actually they don't. They have kind of centers of expertise generally, including centers of expertise for rare diseases, and that's not really what we want. And then other countries have very specific with, you know, very high level standards, and that's good. If you can reach that high level standard, that's what you should be doing. We do want centers that are not dependent upon a single clinician, that are able to do the, you know, the diagnostics or to be in touch with diagnostic services, who can access and use best practice guidelines and apply the best possible treatments and care. We ideally want, you know, that multidisciplinary, both medical, but also the social so all of these things in time, we want all of our, you know, countries to have centers doing this. But realistically, if, you know, the best a country can do or a region can do, where there's basically nothing at the moment, if the best you can do is to actually have an individual doctor who is committed to rare diseases and working in rare diseases, then actually that's the best that there is. And so, you know, we have to work with that and respect that, and then try to support that individual to build more of a kind of comprehensive center around it.
Thank you, Vicky. That was really insightful. We also have a hand from Madhulika.
So a very interesting presentation. I was just wondering, as I just mentioned some time back, that as of now in our country, the overall aim and some objectives which are general have been assigned to various centers of excellence. And as I mentioned, it would be a real good idea to see the outcomes and assess the performance of these centers. So I just wanted to have an idea from the group that would it be a good idea, because the centers of excellence which have been identified now and will be identified later, say in our country, each center may be having different kind of expertise, and maybe their need, the need for their region may be different. So is it a good idea that each center of excellence, apart from some general objectives which is there for all the centers, would it be a good idea to have specific terms of reference for each center of excellence, as we do for the WHO collaborating centers also, and the report is submitted at a specified time, like we have for WHOCC, it is after 5 years. So if something like that can be built in, depending on the expertise and the need for that particular region where that center is existing. So is something like that is a good idea. So for example, the centers, as Victoria was saying just now, that some centers may be having more high-end facilities as compared to others where you have more clinical or more routine diagnostics. So maybe some of the centers with high-end facilities may have a research terms of reference, whereas others may be having more, say, diagnostics or building new diagnostics or networking or something like that. So just an idea whether it sort of makes any sense. So from my side, thank you.
Thank you, Madhulika. Anyone would like to build on what Madhulika or Vicky said? So the idea to have like general general goals, specific, and also at the same time have a specific ones, depending on the center, on the region, on the country. I think we have squeezed your brain too much today already.
That's some good conversation.
I mean, it's, I guess the, you know, the message is, what's the saying? It's, you know, we shouldn't let perfect be the enemy of the good. Is that the saying? So in other words, it's, you know, we know what we want to get to for all of our countries eventually, but we, you know, we have to start somewhere. And so whereas for some countries the goal will be actually for centers of expertise to function much better, to be, you know, really officially designated, and ideally to do, as we said earlier in France, to have some real support from central health systems to recognize these extra roles that people can't do all of these things that we want them to do for nothing. that's great. That's definitely one goal. But, you know, at the same time, in other regions or other countries, and the goal is very much actually to give some visibility so that at the bottom line, patients have somewhere to go and someone they can approach. And, you know, it's difficult because ideally, you know, the Spanish approach is great in the sense that there's a formal official approach there. But you think, you know, sometimes it can be too bureaucratic, as Alba was saying, you know, and you got to think about what does the bureaucracy mean. So if going through all of those steps and those very in-depth accreditation processes means that you as a center, you know, get a lot of government funding, lots of health system funding, then maybe that's worth it. But actually, you know, in other cases, you know, if there's no immediate likelihood of your health system or your government providing, you know, however many millions a year for a center to really do all of these things, it's better surely than having nothing. It's better to have, you know, a patient organization in the region to say, actually, these are some of the centers that we know from the criteria we've done, even if it's a sort of informal, non-official governmental process. These are the ones that, you know, we know patients can be seen at and they can go to for support and guidance on where to go. So yeah, there's a performance role in designating centers of expertise, but there's also this kind of, you know, there's almost sort of a signposting role. And sometimes the patient groups do that themselves anyway through their own websites or through their helplines or things like that. And they, you know, somebody rings up and says, I don't know where to go. I think you know, my local doctor can't help me. And they play that role. So yeah, it's divining, it's helping the mature and the, you know, already quite fortunate health systems to get better and to be a lot more efficient and, you know, do things in the best way. But it's also helping our up and coming areas to get on that pathway and to develop in a stepwise way, and ideally to avoid where some of the countries that have done it already have you know, gone wrong. I think of my own country, and there are things that are good about our kind of approach to centers of expertise for rare diseases, but there are also things I have a big problem with, where if we'd done it in a different way from the start, I think it would be so much better. And once you're in it, it's kind of hard to change. So
thank you,
summed it
Vicky.
up perfectly, Vicky. And that's the point of our work today, is to ensure that we're not only talking about mature systems, but also working towards establishing some sort of recommendations or suggestions for those up and coming countries. So this is the first part of our work. And after May, we're going to be looking more into how to balance it with less and more advanced, less and more mature countries. So I see Loredana's hand and Carlos.
Yeah, again. Well, I can share our experience here in Switzerland because we are right in the process. So the national concept, which was adopted in 2014. So the first project is designation of expert centers. And to do so, they create a committee, a national committee of rare disease with patient, with university, hospital, non-university, the politics, also the Ministry of Health of the different cantons, and together they provide the criteria, and the criteria are more or less the one as Nord suggests, you know, the multidisciplinarity, but not only multidisciplinarity, but professionality as well, because different kind of professions. And so we did designate center of rare disease first, which are the entry points for undiagnosed patients, and behind they have the networks. And now we start with the expert center by group of disease, you know, metabolic, neuromuscular, and we did with the first two pilots one. And the result is, as we said, quite bureaucratic for the center to be motivated and to fulfill all the criteria. And now we are in the process of change a little bit the process of designation. But one key point which is asked, and in Switzerland it's quite a challenge because there are three different languages, it's to have the network first. First, you have to build a national network on a specific group of disease, and then you can apply for a reference center, to be a reference centers, because this allows to the patient to be seen close to their place, and then the expertise can travel in the network. So I think the idea to map again and then put the people together, even if they don't speak the same language, because it's a challenge. But now we can see that professionals are more and more, it's a win-win collaboration, and they realize that now. And also for the patient, of course, because a patient with a specific disease can be seen close to his home, but the expert is maybe at the other hand of the country, but the expert can share, and the patient is, you don't need to send the patient. So again, mapping and put together the expertise and build the network. And then it's one of the criteria to be a reference centers is to have the network first.
Thank you so much, Loredana.
Carlos, I see your hand.
Yes, we discussed about the mature health systems or the development health systems. And I think that also it was mentioned in the other workshop, how maybe it's a good idea to create something that maybe we can define as a center of excellence level 1 and center of excellence or center of reference or treatment level 2. And for example, when try to map in the network in the hospitals in the country, and we identify that is not a mature system, maybe we can define this level 2. And this level 2 need to have a connection with the level 1 that maybe is in the main cities in a big country, and have a training program that, like we mentioned also in the other time with WFH, and they can learn for the other one and then establish an amateur level for level 1 in order to support. I like all of the process that for the certification, maybe knowledge on leading that we have some limitations in some countries. Maybe it's important to ensure that I have the minimum criteria to ensure that is a center of reference for rare diseases. And then moving this national committee or regional committee to improve the centers to level 1. Maybe that is the steps that we need to follow in the country that is in developing for center of excellence.
Thank you so much, Carlos. Just let me add that regarding the accreditation, you will receive a video with different ways and proposals to do an accreditation. So you will get more information about that after the workshop. Any more comments on that? So would you say that in your countries, in your respective countries, would you find that is an easy process or to identify expert centers or the expertise? If you have to improve it, what would you do?
For me, I mean, it does depend very much on the country. And obviously, we've said for a long time for small countries or for countries initially, actually, rather than attempting to be, quite ambitious and think about centers of expertise for metabolic diseases, centers for neuromuscular diseases, it's sometimes going to be more, more sensible just to have a kind of a center for all rare diseases, or, a coordination center or a reference center for all conditions. So thinking about, really small countries like Malta, for instance, that just makes better sense. It's small enough so and those people are all in the 1 or 2 main hospitals. But where possible in countries, I think it is good to think about that more granular level. And I think, the ERNs have given a helpful grouping, that those groupings that they use is a helpful way to try and organize, because there's always a discussion of how granular you go. Do you really dedicate a center of expertise for maple syrup urine disease, or do you go for metabolic diseases? And I think having some vision of, you have to start with what's there, right? So if you actually don't have a center for, any of your centers in your country deal with rare metabolic diseases or deal with, neuromuscular diseases, and if you can't sort of manufacture it per se. But I think, having Yeah, but having something at a high level is helpful because, you know, if you go kind of high level somewhere, then all patients will know where and all doctors, all primary care physicians will know better where to refer people. And so that's something that if I think about the UK, we don't have. So we have some really good clinical services and really good expert services. And they sometimes are for groups of diseases, but they're also sometimes really specific. So they have, you know, if you're trying to find where the sort of experts in something like, you know, Alström syndrome or Bardet-Biedl syndrome might be, then you can find that because they have a beautifully mapped out service. But if you're looking a bit more, you know, high level, and if your condition's not one of those conditions covered by those, say, you know, 143, what we call highly specialized services, then actually there's no place you can go. There's no map where you can say, actually, these are the centers across the UK where there is expertise of some level in rare renal, in rare metabolic. And I think that having that high level approach is actually quite helpful.
Mm-hmm.
Because it gives a place for patients to go, whereas, you know, yeah, if that makes sense, maybe not.
No, it makes sense.
It does.
And that's what actually we saw in Roberto's video. They started with one center for comprehensive care, and that's their base. And then now they're expanding to different regions. And that is working for their system. Anyone want to build?
I guess the three key words is mapping, networking, and coordinating.
I like that.
Map, network, coordinate. Because once you put people together, then you can.
Mm-hmm. Yeah. And I also like the idea of the level of the different levels of care. So people can aim to go to the next level. So
yeah,
it's like a short-term ambition that is always.
Yeah. And then also how we can improve the digital. Now we're having digital boom, and then do we need to get advantage on this and get all the connections, not only physically or through the different connections between the hospital and the academia. Also now is important to improve this for beyond the country.
Mm-hmm.
Yeah.
Yeah, I definitely agree. And I'm seeing a lot of overlap between both of these areas of intervention. So most likely we're going to take your feedback and set it up under the map, network, coordinate, aggregate all these actions together.
Thank you so much. I think we're not going to squeeze your brains more. I think you did a great job. So I'm going to give the mic to Nida so she can close the session. Thank you so much.
Thank you, Concha. So I guess just to recap, we saw these 3 videos on setting up networks, designating centers of excellence, and also identifying shared guidelines. And I think it's really important to highlight that each of these videos had shared a different perspective, and they had a different leading national authority in order to guide all of these processes. So in Brazil, it was the patient organizations, as well as in the US, versus in Spain, we saw it was the government who was the leading national body on this. So I'm glad it sparked really good discussion, and I'm so glad to see you all motivated and just see such active participation. I'm excited because in terms of next steps, we're going to take all of your feedback and have you finalize these next 2 recommendations and also cover the last 2 on health promotion and multidisciplinary care. So I'm looking forward to seeing you all on the 9th of May. Please try to join. Thank you very much for contributing today.
Okay.
Thank you.
Thanks, everyone.
Thank you.
See you soon.
Thank you. And you will share the presentation.
Yes, we're going to share it.
And I'll try and share the last recording with you too, because of the
yes, otherwise I have to ask maybe a special access from the hospital. I'm not sure they will, but okay.
Or if you had a different email address, like a Gmail account or something, maybe we can try with this one.
Well, no, we are all, I have an orphanet address, but again, it's also in the hospital. I don't want to give my private one.
Okay.
Could I share it with you on YouTube? If I upload it on YouTube, would you be able to access that?
Oh, yeah, yeah. Well,
Fabulous.
yes. If
Perfect.
not, I'll let you know.
Okay, thank you.
Thank you. See you
Bye.
Thank you.
in 2
Bye-bye.
weeks. In 2 weeks then. Bye.
Bye-bye.
Wait.